well, here to talk about these changes is Dr. Mike Bauman, Chief Medical Officer for MountainStar Healthcare. Thank you for your time here today. A lot of questions surrounding this. Now, we touched briefly what MountainStar Healthcare is doing to help prepare for the coronavirus, COVID-19. But what else is being done, Doctor?
Sure. Thanks for the opportunity.
Yes.
Number one, MountainStar is part of, we have 8 hospitals in the state, but we're part of a much larger organization, Hospital Corporation of America. So why do I mention that?
Yes.
It's because we have access to over 180 hospitals' experiences, and that's within 21 states. So we've taken that information in combination with what the CDC is doing. We have a close relationship with the CDC and also with state health departments like Utah to plan where we're headed. And we've actually been doing this for weeks. So last week, for example, what we did was, number one, make sure we communicate all this information. We do that on almost a daily basis, and we did that actually today at 2 o'clock. Number two, we're working with our supply chain to make sure we have all the key resources that we need for our employees and our patients, such as N95 masks.
Right.
And lastly, most importantly, last week, we actually started what we call active screening of patients. We were the first in this area to do that, and that involves quite a few things, including actually being sure we have appropriate entrances and exits to our hospital.
Tell us too, there is a lot of, people saying, as the media, are we getting this information out so much that people are getting more scared because they're getting this information and we're creating this fear factor? Do you feel like, I know that's not necessarily one of these questions, but I need to get it out there for those who are watching. Is it important that they're hearing these numbers, that they're hearing these precautions to take? What's your take on that?
Yeah, I think number one, we need to take a little bit of this and take the pulse down.
Okay, good.
We need to take a big breath and look at what's really happening. And as we get more testing and we see more patients, if we call it, the denominator is going to go up, but it's not because necessarily the disease is worse. We're just finding it.
Okay.
And on top of it, we need to do basic care around this, including hand hygiene, hand hygiene, hand hygiene.
Right.
And something I call social distancing. You mentioned that on your lead-in here about 6 feet. And also avoiding crowds if you don't need to be in crowds, as an example, particularly if you're older and you have comorbidities.
Okay, thank you for that information.
Sure.
I just want to make sure the public knows that we are aware of what they're saying. We want to make sure they're getting the right info.
Sure.
So what does the hospital screening process entail, going back to that?
Sure. Well, actually it involves a lot of work at each of the facilities. You can get into hospitals through any number of entrances. So the first thing we had to do was say, where do people come through, and limit that. Obviously, we'll continue to have entrances through our ER, but then we narrowed it down to 1 to 2 per facility. Additionally, what does active screening mean? That is a non-invasive approach to actually talking to potential visitors about a couple of things. Number one, do you have fever or do you have respiratory symptoms, usually cough and shortness of breath? Number two, have you come from a COVID hot country like China or Italy? And number three, have you been exposed to a COVID patient? If you answer any one of those, we actually ask our patients, or actually our visitors, please don't come in. We don't want to expose our patients and our employees to potential additional health risks.
Okay, so we have to wrap, which we could talk for a whole half hour on this. We'll, of course, send them to our website, abc4.com, for more information on this. And we really appreciate your time here today, Doctor. For now, we'll send it back to you, Rick.